As we told you this week, Nova Scotia's government has announced significant changes to the way it delivers emergency care. But the plan is getting mixed reviews. Brett Ruskin joins us live from Halifax to tell us more. Good morning, Brett. Much commentary happening on this. What are health experts saying?
You know, lots of people have been responding to this announcement that took place earlier this week. And lots of people kind of agree that there needs to be some kind of a change. Many people agree that the changes announced will be positive, but lots of folks are saying that there could be other steps taken. So we take a look at that letter that was sent out by those 40 emergency room doctors saying, hey, what we really need right now is for the emergency departments to flow through better, to have more patients from the waiting room going to see nurses, going through the triage, going to see doctors, to increase that flow. We heard from the Nova Scotia Nurses Union, who put out a statement yesterday saying kind of very specifically that there needs to be less administrative tasks placed on nurses, more power to prescribe medications, because that's what a lot of folks go to emergency rooms for now because they don't have a doctor, and also the same kind of benefits that are afforded that have been announced for paramedics to have that tuition relief, that should be afforded and given to nurses as well. Now, we also heard late yesterday the statement from Gunter Holtoff. He is the husband of Allison Holtoff. We remember her story. She was they went to the hospital up in Cumberland County on New Year's Eve. They waited for hours to see a doctor, and Allison eventually died in that emergency department. He said that what was announced this week is basically too little, too late. He would like to see the same kind of response that we saw at the beginning of the COVID-19 pandemic, with that ramping up of staffing, of support from government for those emergency departments, for hospitals. And he says something that basically everyone could get on board with and could support, that this problem of healthcare in Nova Scotia has been years in the making, but we can't take years to fix it.
Brett, thank you for this. Brett Ruskin in Halifax.